Miss Spencer. I'm your nurse.
Hi,
Trey.
I'm Tracy.
Nice to meet you.
Nice to meet you.
So today I was going to give you education on breast self-exams.
Okay.
So the purpose of doing a self-exam on your breast is to look for any abnormal findings and any lumps, anything out of the ordinary, so that you can better prevent late-stage breast cancer.
Sounds good.
So if you're still menstruating, you want to do these self-exams 4 to 7 days after you start your cycle, because that's when your breasts are the most tender and the most, that's when you have the most hormones in your body. If you are in menopause, you're going to want to do it about once a month. So just pick a day a month and that's when you'll do it.
Okay.
So the first thing you're going to want to do is you're going to want to check the symmetry of your breasts and the movement. So you want to take off your shirt and stand in front of a mirror. And there are a couple ways you can do this to check. You can put your hands behind your back like this to check if the symmetry, see if they're the same size. Or you can put your arm above your head like this, both of them, and you can check that way as well. So you're looking for if they move the same way when you lift your arms, or if they're the same size. That's what that's for.
Okay.
Next thing you're going to do is you're going to want to palpate your breasts. So either in the shower or you can do it laying down. In the shower, people find it's easier because of the soap and the water. It's easier to kind of maneuver. You're going to want to put your arm above your head. This also gets tissues out of the way just so that it's a little more, it's easier to access. So you're going to put your arm above your head. You're going to use the 3 pads of your first 3 fingers, and you're going to want to form a pattern. So some people will move up and down across their breast. Other people will start in the center and move outwards. So when you do this, you're just going to move up and down across your breast and make sure you get all the tissue. So you have 4 quadrants in your breasts. You want to hit all 4 quadrants, and then the axillary tissue, because it also has breast tissue in it as well, and you can get lumps there as well. Does that make sense?
It does. Thank you.
Okay, so things you're looking for, some kind of abnormal findings you're going to want to tell your doctor about. The first is any lumps that you find. So anything, a lump. And when you do palpate your breasts, make sure that you do light and deep pressure so that you can get all regions of thickness on your breasts as well. And that will help you find lumps. Okay. You're also going to want to look for any kind of skin changes. So dimples in your breasts, either if it's just one singular dimple or there's a condition called like orange peel skin where your breasts look like an orange peel. That's also a warning sign. You're going to want to look for discharge out of your nipple. If you're not lactating, that's not normal. So that's something that you're going to want to tell your doctor about. If one of your breasts is abnormally larger than the other, that could be a warning sign. Now some people do have, for some people it is normal to have one breast bigger than the other. But regardless, that is something that you want to tell your doctor about, just to be safe. Any redness on your breast, any abnormal redness, or any heat coming off of your breast is also good to tell your doctor about that as well. So really anything that is different from usual is something that you're going to want to talk to your doctor about and get further testing on.
Sounds good.
Okay, do you have any questions?
I don't.
Okay, perfect. Well, it was nice to meet you, Tracy.
Nice to meet you, Spencer.